if they have a transplant, right? But if they have a transplant, what are they always at risk for?
Infection.
How long they gonna be on the immunosuppressant?
For the rest of their
life, okay? What about somebody with an autoimmune disease, like lupus, rheumatoid arthritis, Crohn's disease? Are they gonna be on immunosuppressant?
Yes.
For how long? For life, okay? What do we teach them about? Infection.
Don't go in big crowd.
Don't go. So they got the Jazz Fest coming up, and Essence Fest, should they go to that?
Yeah, they gonna go.
They gonna go.
They gonna. They don't have help when they go.
Should they go though?
They go.
They shouldn't
So
go.
they still can't have first blood of all of these, those people?
No, not if they're on immunosuppressants. Well, it's really when they're on immunosuppressants and their immune system is really low, okay? They forever have to be worried about a risk for infection, like forever, ever, ever, ever. Make sense?
So that's like Crohn's and all.
Crohn's, lupus. Yep. So we talked about steroids. We have medications called cytotoxic drugs. You know what cytotoxic drugs are? They kill your cells, all right? So that's basically chemo, because that's what cancer is, your cell. It's not like a bacteria that comes in, it's not like a virus that comes in. Cancer is your cell growing out of control. All right, so usually your cells are supposed to grow, and then it divides, and it goes away, it grows in a nice decency and order. But cancer cells run amok. They do whatever they wanna do. They grow so much that now they have a tumor. And that tumor can do a whole lot of things. It can pinch on nerves, it can produce like chemicals, like a tumor just kinda does whatever it wants to do. There's no order, okay? So chemo is considered a cytotoxic drug, okay? And we talked about immunosuppressants, right? You wanna check for risk of infection. The main thing is patient teaching, right? Patient teaching, okay? You wanna teach them the common signs and symptoms of infection. Take the drug exactly as prescribed. Okay, let them know if they develop jaundice, that means their liver has been impacted, okay? Take medications with a full glass of water. We don't want them to take any other drugs or supplements or herbal products or anything like that unless they let the doctor know first, okay? Pregnancy is a contraindication to immunosuppressants. Why do you think? Right, so if you're at risk for infection, then what's really gonna happen with that fetus? You're really putting them at risk, okay?
You said pregnancy is a common what?
It's a contraindication. Like, we don't want pregnant people to be on immunosuppressants. Alright, another reason is when they're on immunosuppressants and they're at childbearing age, then we tell them to use forms of contraception, because we don't really want them to get pregnant while they're on these immunosuppressants, okay? We don't really want them breastfeeding, all right? Because what's gonna happen, the immunosuppressant's gonna be in the breast milk, and then what's gonna happen to that baby? Risk for infection. And the baby already has like an immature organ and system and stuff, right? So we're just gonna make it worse, okay? So the major thing is immunosuppressants, they're gonna lower their immune system. So as a nurse, what's the main thing I need to know? If I know it's gonna lower the immune system, what's it gonna put them at risk for? Infections. So the major thing with immunosuppressants is I need to teach them how to decrease their risk of infection. I also need to tell them to let me know at the first sign of infection. So that means I need to teach them, what's the first signs of infection? Fever, sore throat, cough. Alright, they need to let us know, okay? Make sense? Questions about medication that affect the immune system? Questions? This last one is talking about cancer and chemo. Remember I told you, I'm not going into detail about chemo, right? Not going into detail. The only thing I want you to know about chemo is that it targets fast-growing cells. What does it target?
Fast-growing cells.
What cells are fast-growing? The tumor is one, right? It's a tumor. Your hair follicles are fast-growing cells. The GI cells are fast-growing cells. And your bone marrow produces fast-growing cells. So that's like your red blood cells, white blood cells, platelets. All right? So what does chemo target?
Fast-growing cells.
So it doesn't just target the cancer. It targets any cell that's growing fast. So that's why hair follicles are fast-growing. That's why their hair falls out. Because chemo is attacking the fast-growing cell. All right? The GI cells are fast-growing cells, which is why they have nausea and vomiting. Okay? And the bone marrow are fast-growing cells. That's where all your blood cells grow. So red blood cells are going to be depleted. White blood cells are going to be depleted. Platelets. So they're going to be tired. They're going to have a risk for infection, and they may bleed. Okay? So what does chemo target?
Fast-growing cells.
So fast-growing cells include the hair, right? What's going to happen to the hair? What's going to happen to the GI tract? Nausea and vomiting. What's going to happen to their blood cells? So they're going to bleed because of low platelets. Their immune system is going to be low because of low white blood cells. And their red blood cells are going to be low, which gives them anemia or fatigue. Okay? What do I do about their hair falling out? Is that a big deal?
No,
That's normal. So we tell them to cut their hair before it starts falling out. Why do we tell them that? If somebody got super long hair, it's less traumatic. Okay?
they turn black.
They may become brittle, and it's because of the red blood cells and stuff are gone. All right? So we tell them to cut their hair before it starts falling out because it's less traumatic. We may want to get them in touch with like a special wig shop. I'm not talking about the corner store hair store. I'm talking about people who specialize in people who like had chemo and need like real special made wigs.
Tattoo artist for the eyebrows.
Now they have like a new like semi-permanent eyebrows now, like
They put it on.
yeah. All right. So am I concerned about the nausea and vomiting?
No, that's normal side.
I am concerned because if they have too much nausea and vomiting, can they eat?
No.
And I need them to eat, okay? So if it becomes too bad, then of course I'm gonna give them something for nausea, I'm gonna give them something for vomiting, all right? That means if I have a patient on chemo, am I gonna wear perfume, taking care of them?
No.
No, because they're gonna throw up on you. Even lotion, okay? You may think that it has a light scent, but somebody who has nausea and vomiting is strong, okay? Am I concerned about them having low red blood cells? Yes, because they're gonna be extremely tired. Am I concerned about them having low white blood cells?
Yes.
Yes, because they're at risk for infection. And then here come all that others talk about, no crowds of people, no kids, that sort of thing. Am I worried about their low platelets?
Yes.
Yes, why? Because they're gonna bleed, okay? The only thing that will pause somebody's chemo is bone marrow suppression, which is like the red blood cells, white blood cells, and platelets. If that drops too low, then they'll have to stop chemo. Now, if their hair falls out, do they stop chemo? No. If they have nausea and vomiting, as long as we can control that, we don't have to stop chemo. But if they can't eat and they're starting to lose a lot of weight, then we have to stop chemo, okay? So again, I'm not going into detail about the different types of chemo, because there's a lot. I just want you to know the overall what happens. So what does chemo target? What are fast-growing cells? Make sense? Am I gonna go in there with perfume on?
No.
But Bath and Body Works has their Bath and Body Works has their semi-annual sale. You know those body sprays be like $20, they're $3 right now. Huh?
Right now.
They're doing it right now.
Right now, it's over June 30th.
Oh.
And I done got buku stuff. Yes.
Do you sell it?
Huh?
Do you sell it?
No, I got that for me.
Some people buy like just settle, they discuss themselves.
And I bought it for Christmas too,
Now I
So- cause it's all the candles and all that kind of stuff.
The candles on sale too?
It's a semi-annual sale.
Oh, shit. So till June 30th, that's
Yeah.
Friday.
But go
We're
ahead
gonna
and
have
have
to
to
get
get
two
two
extra
20% off right now.
Alright, so this is all the content on the test. So I'm gonna throw some test questions at you.
Come on, please.
That's all. I told you you were anxious for no reason. So chemo is too specialized. It's too specialized. Alright, you just need to know overall how chemo works and what the nurse will have to do. Okay? Y'all ready? Yeah, y'all can always take me, it's fine. I told y'all that. Take my back, record, that's the better word.
That's what I should have said, yes.
My bad.
Record, now record.
This shit just like a crap. All right, y'all ready?
Yes.
My patient has been taking doxycycline for 5 days and is now complaining of vaginal itching. What can we expect the doctor to order?
Diflucan.
An antifungal. Okay, why?
She's developed yeast infection
How?
and overgrowth of the fungus.
Kill the good and the bad. And if the doctor don't want to use, so it'll give you.
What kind of yogurt?
With the live.
Okay, so you notice whenever I ask you a question, I keep saying why, because I can change the question any kind of way. And if you can answer all the whys, you can answer any question I throw at you, okay? So I have a patient that's taking, chemotherapy and is complaining of extreme fatigue. What is causing her fatigue? Low red blood cells. Okay? I have a patient that recently had a kidney transplant and will be taking an immunosuppressant and wants to know how long they have to be on this medication.
Transplant.
I ain't even finished the question. That's what y'all do on the test. All right. This same patient who is on an immunosuppressant wants to know ways to decrease their risk for infection.
Don't eat fresh food.
Oh, right.
Stay away from your house.
What about hand washing? That's a big one, right? Yes. What should their visitors do?
Wash your hands.
Should they be touching over all kind of stuff?
No.
Should they sit on their bed?
No.
Y'all, I just thought about this. As a nurse, do not take y'all behind in there and sit on the patient's bed. That, have y'all seen nurses do that? I think that is so rude.
What you mean?
So, y'all sit on the patient's bed?
They don't build isolation. I have sat down with a patient, like when they be crying or something, I done sat
Pull a
down.
chair up.
Yeah, it normally don't be no chairs. Yeah, I'm guilty of that, I ain't gonna
Also,
lie.
because you don't know what's in that bed.
Yeah.
One day you sit in there, you get up wet.
Oh, nah, I ain't, nah.
End of the shift there.
I'm going straight home.
Okay? My mama does that, alcohol and holy water. I hate the first day of school, she come to my house and be, like, Mama, it's on the Jordan River. I'm more like, and so the kids be like this. Soaking wet, going to school. All right.
One day, I went to a date with my husband, to dinner, and they said like, okay, your waitress is coming. So like, okay. So when she said like, okay, what you want? I said like, okay, and I was looking at the menu. When I looked at her, it was like me and my husband. She said,
At the table.
at the table. And I was like,
Ma'am, I'm like, I don't like it.
what you doing, girl? Like, I'm not gonna give you any tip.
That meant you were taking too long.
I said, no.
She was trying to be too
came.
friendly.
Yeah, then we said like,
Get up.
I don't like that. And I don't want it to be rude, but like, okay.
The word is, her husband was there. No, get up.
No.
Okay, so my patient calls the nurse into the room complaining of itching and flushing while receiving vancomycin.
Redman syndrome.
You don't even know what the question is.
Alright, we can't no longer ask the
Should the nurse notify the physician?
No.
See, that one, we should. Okay?
But wait, Redman syndrome, itching is not one of the symptoms.
Yes, it is.
Sometimes when people are flushed, it can make them
Right,
itch.
okay,
They-
so the skin is stretching? Okay.
And then there's like blood is
Okay.
moving there quickly. And
Okay.
so it's kind of like whenever you're sitting down for too long, when you finally stand up and the circulation goes back, that kind of feeling, it kind of feels like that. All right? Barbara is an 86-year-old patient, taking levofloxacin and is complaining of pain in her lower ankle. What does the nurse expect has happened?
Tendon rupture.
Can we go take this test now?
My patient who's taking ceftriaxone, keyword ceftriaxone,
Set your ass on.
is complaining of vomiting after morning care. What should the nurse ask the patient? Yeah, you better answer than that.
What did you say?
Let me ask the question again. My patient is taking, ceftriaxone, is complaining of vomiting after morning care.
What kind of mouthwash did you
What kind of mouthwash did you use?
With the alcohol, not water.
What kind of mouthwash did you use?
Wait, I must have missed that one. So what category does that medication fall in? Okay.
Except the giant,
The giant.
Got it, okay.
okay? Margaret is also, taking Rocephin after having abdominal surgery and develops a fever. The doctor prescribes acetaminophen elixir, 650 milligrams by mouth every 4 hours as needed for a temperature greater than 101.
That's too much information.
Okay. But all you, that's a whole lot, right?
Because there's too much information. We just find out what you need.
What should the nurse do?
Call,
The nurse should question the order because they're on cephalosporin, Tylenol elixir has alcohol in it. Make sense? I know, I was trying to get y'all. I was trying to get you. Trying to get you. My patient is taking gentamicin for an eye infection and is now complaining of difficulty urinating. Should the nurse contact the physician?
Stop the medicine and check the eye and don't put out.
Should the nurse contact the physician?
No.
Let me ask the question again.
No.
My patient is taking gentamicin for an eye infection and is complaining of difficulty urinating.
Oh,
Should the
yes.
nurse contact
Oh.
the physician?
Yes.
Yes,
Yes, why?
because if they have decreased
Toxicity.
urine output, that's because of
Toxicity.
And it's caused by,
That's the
oh, that's the height, that's toxicity. Toxicity, okay. So I'm just letting y'all know, I'm not gonna be using those words all the time. I'm gonna give y'all some symptoms of the toxicities, okay? My patient is complaining of ringing in the ears.
I don't, stop.
While taking vancomycin. Should I contact the physician?
No,
Yes.
Why?
cause it's toxicity.
A low toxicity. Okay. My patient has been prescribed Bactrim DS for a complicated UTI and states, I'm only allergic to sulfa drugs. What should the nurse do?
Contact for something else.
Contact the physician, ask him something else, because Bactrim is a sulfa drug, okay? My patient is taking linzolid and is scheduled to have a, work meeting at a restaurant. But I'm gonna say what she was at. So my patient is taking linzolid and is scheduled to have a work meeting at a restaurant. What should the nurse reinforce with this patient?
No aged food, no alcohol,
No age,
So
no wine.
typically when we say restaurant, we know it's got something to do with food,
Yes.
food or drink.
So why I went there?
Oh, why you says?
I was thinking about steps outside the sunlight.
Yeah, I said linzolid though,
Yeah,
in the
you
restaurant.
No.
So what we gonna reinforce?
No tyramine
So
food.
tyramine containing food, so that includes beer, right? Can they have beer?
No.
Red wine?
No.
Pepperoni pizza, can he order that?
No.
Can he order a cheese pizza?
No.
Yeah.
If it's
No.
No, it's not cheese, they don't know cheese, they don't know.
Okay, some kind of cheese they use.
Just don't cheese.
So here's the thing though, I don't really know what aged cheese is. I know like blue cheese is aged cheese.
One stage Gouda?
Yeah,
Is
Google.
mozzarella aged cheese?
No.
Okay, yeah.
Steer clear of the cheese.
Steer clear.
All right, can they have like salami?
No.
Hard salami? Okay. Restaurant food, key word. If restaurant is in the question, it has something to do with food or drink, okay? Not sunlight. Okay, my patient is taking a tetracycline and is complaining of a really bad sunburn. What is the nurse's response? What causes sunburn? Photosensitivity of the medication, okay? My classmate showed up to the doctor's office with her daughter asking for doxycycline because they saw on the internet that that's really good at treating complicated infections. Her daughter is 8 years old. What should the nurse, how should the nurse respond?
No.
Sorry.
I'm taking doxycycline and it really makes my stomach hurt. So I'm gonna go ahead and stop taking it. What's the nurse gonna tell me?
You must always complete.
That's not a good answer. Okay, so what you gonna do? Can I take it with food?
Yes.
What kind of food?
Not milk.
With calcium and stuff in it, okay? So no milk, can I take it with ice cream?
No.
Yogurt?
No.
Can I get me like a, grilled cheese sandwich?
No.
Oh, so you gotta be very specific when you talk about taking with food. Some of these, like tetracyclines, it depends on the type of food. Make sense? My patient's taking azithromycin for, pneumonia. What medication can I expect them to also take? Steroid. What do I put them at risk for?
Infection.
How am I going to stop that steroid?
Just take off of it.
Oh, it sounds like y'all ready.
Yeah, to the test, get it right.
But see how y'all had to stop and think about what the question was asking, like the whole morning care. morning care, we know that means brushing your teeth and that kind of stuff. So you should automatically think about, okay, oral care, they're taking, cephalosporin, oh, it's probably got something to do with their mouthwash with alcohol in it, okay? So y'all, when y'all get in front of this test, I need y'all to read, don't read.
I'm telling you,
Well,
I'm trying to
first-
get to that math.
First, my son has to go to 3 different computers.
Right.
I know.
We don't be
like
like
30 minutes.
I know, cause we won the only class the last time.
You know what?
Yeah.
I reserved it.
Well, they did.
Last time I did first.
It was cool though. You gotta, answer questions like you pushing that bank of money.
Answer questions like it's an actual patient. Don't add nothing to it, Donna. If I say a restaurant, I'm not talking about when you walk outside the restaurant. I'm not talking about that, Donna. Read the whole question, because you may read the beginning of it and think it's asking one thing, and when you get to the other part, it's like, oh, it's not even asking you that. Make sense? Questions, is there anything you have questions about?
How many questions on that?
50, it's always gonna be 50 questions.
Well, last time it was.
I know, wait a minute.
Y'all, that was a rough week. Yeah, I even had double math questions
I
on
kinda
there.
appreciate my test, I was like, well, I mean, it is double, so maybe one to get thrown out, that's how I was kinda looking at it.
If you want to know, we're not ready.
When I went back, I was like, what the heck did I do? Oh my God.
We did.
It's like, oh, she getting them pretty.
I was like, I don't know, I must have been in y'all, that's how I know that whenever y'all don't get sleep or when y'all going through something, y'all need to stop and take a moment, cause I thought I was normal until after I came out of it, I was like, wait, I was not normal. Alright, any questions? Any questions about any of the content? No math on this test, no math. Any questions about the content?
Chapters.
Chapters 8 through 12. Do I care about nausea, vomiting, and diarrhea?
No.
Only with one medication?
Except the Johnny.
Y'all, like, I learned that at school, and it stuck with me, 'cause if I don't know nothing else, I know about septuagint.
And the mice.
Like, in the
Oh, yeah.
mice, about the mice. You get that jingle one, I might sing it Thursday.
Questions? All right, so tomorrow I'm gonna sit down and go through the test, 'cause I saw one question, I was like, what is that question asking? So,
You said you're gonna open it back up so we can see it?
yes, by tomorrow, I wanna go through it all first.
Okay, cause I sure was curious.